Now let's take a look at the cervical spine. As you can see here, the cervical spine has this concave curvature that we also refer to it as lordotic curvature. So the curve is going towards the back here. As you can see, we have 7 cervical vertebrae. Let's take a look at C1. So this is C1. This is your first cervical vertebrae, also known as atlas. Looking from above, this is anterior up here. So this would be your anterior tubercle right here, and therefore this would be your posterior tubercle here. We have these facets right here. We call these facets. This would be your superior articular facet, and you have another superior articular facet over here. We have these holes on this is the transverse process. This whole thing is called the transverse process. And then we have these holes, which are the transverse foramen. So you have one over here, and you have one over here. So this is the whole thing, transverse process, transverse foramen. We refer to this as the posterior arch, and therefore this is the anterior arch here. So we don't have a body for the first cervical vertebrae, but we do have these things called lateral masses. So this right here is called a lateral mass, and this over here is called a lateral mass. And we have this very large vertebral foramen. Now we've brought C2 into the picture here. You can see C2, the dens, which is a structure that we're going to go over. It fits right inside the C1, the first cervical vertebrae, the atlas. So C2 is known as your axis vertebra. So in this view, you can see that the atlas and the axis is C1 and the C2, how they come together, which allows for a lot of rotation between these two joints. We call this the atlantal axial joint, which allows for a lot of rotation. Now that we've removed C1, we can really see the dens, also known as the odontoid process. Looking from above, you can see that dens right there. You can see the superior articular facet right here, and there's also one on that side as well. You have those, here's the vertebral foramen, and you have those transverse foramen as well. You can see that here and over there. You can see this, what we call a pedicle right here. You can see that inferior articular process right here. This is going to articulate or come together with the joint below it, which would be C3 down here. We do have a spinous process for C2. You can see that right there. That is a spinous process. Now we're going to look at the 5th cervical vertebrae. So we skipped a few vertebrae, went down to the 5th vertebrae right here. So we're going to take a look at that. I left C1 and C2 in here so you can see that for reference where it is in the spine. So just like with C2, you are going to have a body. We are not going to have that dens or that odontoid process, but we do have a body for the rest of the cervical vertebrae here. We also have that transverse foramen you can see here. Yep. And then you can also see that on the other side here. This is the transverse process right there and there. You can see also you can see the superior articular facets right there and right there. You can see that vertebral foramen right there. You can also see, we already talked about the transverse process, but you can see the pedicle right here and also the lamina right here. Also, we have the spinous process back here.
So with this view, you can see where those transverse foramen come into play. What is their function? So the transverse foramen, they are allowing passage of that vertebral artery. So you can see this right here. This is the vertebral artery. So specifically, this is a right vertebral artery, which is going to supply blood to the brain. You can see that here. So the transverse foramen is one of the identifying factors. It's a way you can tell the difference between a thoracic vertebrae and a thoracic vertebrae and a cervical vertebrae, and it's an identifying factor of a cervical vertebrae. So you can use that to tell the difference, figure out what kind of a vertebrae you're looking at. Is it cervical, is it thoracic, or is it lumbar?